ELCA has visited one of the clinics for the adolescents run by Doctors Without Borders MSF here in Mbare Township in Harare. And the effects of US funding cuts are being felt.
When I came to the clinic, there was shortage of medicines, and then shortage of social health care workers, because I used to come and do my counseling sessions with them, and then some of them lost their jobs because of the funding. And I was repeatedly coming to the clinic over and over for me to get my medicine. I used to get 4 months supply, and then now they were giving me 1 month supply.
A campaign to educate the locals on the dangers of HIV/AIDS has also collapsed.
Chakwanise kusvika nema-services kana tisisina macondoms nekuti macondoms ari kushota hatitokwanise kutoenda ikoko vanototidzinga.
The Zimbabwe Health Ministry has also revealed an increase in the number of HIV/AIDS related deaths since January.
We have been witnessing an increase in the number of HIV-related deaths due to these funding cuts. Services at this facility have been hampered by shortages of commodities like laboratory commodities as well as pharmaceutical supplies. And we have also been witnessing a number of patients or recipients of care coming from facilities that were supported by USAID.
Zimbabwe was slowly making successful inroads in the fight against HIV/AIDS infections and deaths in recent years, but all is now coming undone.
Zimbabwe now, where its healthcare sector is back in the spotlight. This follows the recent comments by Limpopo's health MEC, where she was caught in video scolding a Zimbabwean patient about the impact of foreign nationals on South Africa's public health care. Back in Zimbabwe, many commentators say the health sector is in a bad state. Penda Dube looks into this for us.
Zimbabwean doctors, rights activists, social commentators and politicians believe the collapse of the country's health sector is due to the economic meltdown. Some doctors believe proper financing can help.
We need better health financing. We need better healthcare worker retention, and we need generally to have motivation in the health sector. In order to keep brain drain, we need to have well-paid workers. We need to have workers that have high morale, have workers that are highly motivated.
However, social commentators say Zimbabwe's health sector is in a sorry state.
It has totally collapsed. There are no medicines in our hospital institutions, in our clinics, and even the resource persons, the medical staff, the doctors, the nurses, they have fled this country. So the current state of Zimbabwe's health care is in a dilapidated state. It has failed completely.
But the governing ZANU-PF is confident the sector will be revived, claiming that the economy is recovering well.
There's this fallacy that the economic downturn of Zimbabwe is forever. No, not at all. This economy is on the upswing. We are beginning to see the fruits of Zimbabwe's open for business.
Due to poor salaries, Zimbabwe's health workers, especially nurses, continue to leave the country in droves, especially to the UK for greener pastures. Pindai Dube.
By the powers vested in me by Section 17, subsection 1 of the Constitution of this Republic, I hereby declare a state of public health emergency, granting me the necessary powers to make decisions quickly to address the immediate medical needs of the nation. In addition to this declaration, I hereby set aside Clause 34, Subclause 3, A and B of the Retirement Fund Act 2022 to enable the establishment of the Health First Botswana Partnership, a 5 billion Pula fund to which the Botswana Development Corporation shall invest the initial sum of 100 million. The purpose of the fund is to facilitate strategic procurement of healthcare supplies to adequately support the public health system's needs, to align procurement activities with the Ministry of Health's comprehensive plan to ensure timely delivery of medicines, consumables, hospital machinery, and spare parts.
Hey guys, welcome back to Everything Entertainment. Guys, please don't forget to like, comment, and subscribe to my videos. I will really appreciate it. Guys, please watch the ads, my beautiful people. Please watch the ads. Guys, in today's video, we're going to be speaking about how Zimbabwe are struggling with healthcare right now in Zimbabwe. Like, it's really tough. Now, the reason why I'm making this video is because of on my previous video, guys, I was saying that the reason why Botswana is struggling with essential medication is because of, like, they said illegal Zimbabweans that are in Botswana should be documented. And Zimbabwean people were coming for me on the comment section. They were saying, "Kuti, like, there's healthcare in Zimbabwe. Why should Zimbabwe go seek healthcare in Botswana? I should not say all of these things. I'm being xenophobic towards Zimbabweans." Now that is the proof. Zimbabweans themselves are saying that they are struggling in Zimbabwe because of there's no healthcare, there's no condoms, like there's nothing for them in Zimbabwe. You get what I'm saying? And I'm not making this video to literally look down on Zimbabweans, but I'm making this video to say to them, Kuti, like, guys, this is time for you guys to fight. There is no way that you're gonna run from one country to another to seek for greener pastures just because of you guys fail to fight for your countries. When is it gonna end? When is it gonna end? What if Botswana is gonna say that, okay, fine, now we see that you guys are depleting our healthcare, now go home? What if they're gonna say that? What's gonna happen? You guys are gonna come to South Africa, and South African medical healthcare is gonna be depleted again. You're gonna go to another country. That is not how it should be, guys. Stay in your own country and fight. Your government is literally chowing money every month because of you don't care. They see, Kuti, like, you don't care about the problems that you have in your country. Wabona. And in South Africa, you will literally fight tooth and nail with South African government to receive free healthcare in South Africa, whereas in your own country you don't even get condoms. That is so diabolical, guys. That is so diabolical. Nowhere to fight. Don't just fight for something that you shouldn't even be getting. The fight should be with your government, and that's on period. That's on period. Guys, Zimbabweans are gonna get to a point whereby there will not be hospitals because of, like, if there's no medication and all that, why should the hospital operate? And if the hospital closes, the doctors are gonna lose their jobs, and doctors are gonna move abroad, or some of them they're gonna come to South Africa, and Zimbabwe is gonna be left with no doctors. People are gonna die right, left, and center. And that's not what we want. We want these people to literally work hard for their own country. Guys, go back and fight. It is worth it. Trust me. It is really, really worth it. Stay in South Africa is just wasting your time. Fighting with South African government, it is wasting your time. At the end of the day, when you go back to Zimbabwe, you're going to find the same situation because you are failing to fail. Guys, oh my gosh, like, this is so diabolical to me, guys. Like, they are saying, Kuti, like, Zimbabweans, they are dying because of, like, okay, fine, let me not misquote the person. They are saying, Kuti, like, there's been the highest number of Zimbabwe dying because of, like, HIV and AIDS. Guys, this should not be a thing. Your government have money to literally buy ARVs, buy condoms, and all of that, but they are using that money for their personal stuff. That is not how it should be. These people should see, Kuti, like, you are eager for changes. These people should see, Kuti, like, you want changes in your own country, but they won't even see it because of why you are in South Africa. You are at Botswana. My goodness. Like, this is crazy. Honestly speaking, this is it's heartbroken to see that people are literally allowing themselves to live in that situation. But in South Africa, they have literally a guts to fight with South African government for housing, for healthcare, for SASA grant, like everything. They fight with our government, but in their country, they are failing to do so. It is so sad. You can see on the video, guys, the president of Botswana, that man looks so distraught. You can see Kuti, like, he was hopeless about the situation because of, now in my opinion, guys, I've never seen Botswana having the issues, like issues with medical healthcare and whatsoever. Like, it's my first time seeing it. I don't know if you guys have seen Botswana having such issue, but now for me, it's my first time. You can see Kuti, like, that man is literally distraught by the situation because of, if they're having a problem with medication right now, it's gonna be a recurring problem, trust me. Because of the same one is gonna be depleted and they're gonna have to have another one. My goodness, this is a lot. Zimbabweans, you guys can see Kuti, like, the amount of strain you guys are causing in all this country. It's a lot, guys. It's a lot. And when we speak, we are being xenophobic. They were saying, Kuti, like, I'm being xenophobic on my comment section. And I'm not trying to be xenophobic. And I'll never come on the internet without proof. No. I don't work like that. I will come with proof. You get what I'm saying? So, Zimbabweans, this is a proof that healthcare in Zimbabwe is struggling. And it is up to you guys to fight for your government. Because of, if you're going to let the situation be like this right now, next year, your hospitals will be closed because of, why would it operate without medication? Like, it's crazy. It's literally so crazy. Like, and there's Zimbabweans that have big platform, guys. Like, oh my gosh, they had platform to literally, I don't know, do something about it. Yeah, but Sana, yo, Mari, they say, Kuti, like, you cannot take a donkey. You cannot you can take a donkey to the river, but you never force a donkey to drink water. That's what they say. So if they don't want to help themselves, we can't help them. We cannot help them. And one thing about South Africans, guys, like, Rona man, I don't know, like, when we see you guys helping ourselves, when we see you guys fighting for your own country, I feel like we're gonna enter the chats. Like, we're gonna enter the chats, like, yeah, Zimbabwe deserves better. You know what I'm saying? But you guys don't want to do that. The only thing that you want to do, you want to fight with South African government for stuff that you are not supposed to get. Like, yeah, but please comment down below what you guys think about this video, guys. I love you guys so much. Don't forget to comment, like, and subscribe. I will see you guys on my next one. Bye, guys.